And welcome everyone to the Real Leaders Podcast. I am your host, Kevin Edwards. Alongside us today, we have Dr. Nigam Shah, a professor of medicine at Stanford Medical School. Doc, thanks for being with us today.
Good to be here.
So exponential medicine, what does it mean and why are you here?
I think exponential medicine is about imagining the future, right? What can we do in medicine? What is possible? And the research I do is all about that, so it's a great place to be.
So imagining medicine and seeing if it's possible, what are some of the things that you have imagined that you're researching and testing right now?
So, for example, today when we treat patients, we record everything we do in an electronic health record. And a health system might treat 2 million, 5 million, 10 million patients. But when a new patient walks in the door, we don't go back to ask what happened to similar patients to inform the care of the next one that we just see. I think that is something we should be doing. And that's what I imagine, and that's what I'm here to talk about.
Okay, so if I went in for a sickness and I got prescribed something, you're saying that my provider usually, or I guess typically, does not reach back out to me to see if that medicine worked?
Typically, and for the most part, I mean, the things doctors do, you don't need to ask, did it work for other people, because we already know they work for other people. But often you're faced with situations that have not happened to anybody else. It happens more often than you would imagine. And in those situations, instead of just taking our best faith guess, we can ask what happened to other 50, 100, 300 people like you that we have treated in the past, and use that data to make a better decision.
So how are you making it maybe more accessible for a patient who might not want to go out their way to tell a medical expert, this is how I felt and this is what happened?
So this is actually for the clinician, and the patient doesn't have to do anything else. They just go see their doctor, and for example, let's say there's a patient who has a slight elevation of a particular blood test, and generally speaking, a physician would say, oh yeah, that's a little bit elevated, mostly normal, fine. But in our case, when we see something like that, the clinician can ask us, saying, what happens to these people 6 months into the future, 3 years into the future? And we can tell them that for this kind of an elevation, 6 months later, there's a very high chance they end up with a blood cancer. So see them soon and don't wait 3 years to see them again.
Okay, so the clinician is then reaching back out to the patient to see?
Correct.
And how are they doing that? Is that through a phone call?
Through the regular channels of care.
Okay.
Think of it this way. Whenever someone a doctor has a situation where they're not sure what to do, you get a second opinion.
Right, okay.
The idea is to get a second opinion from the database of your hospital.
Okay. And maybe some results that you could share with us, or are you still testing these methods?
So we've been running this as a service for about a year and a half at Stanford.
Okay.
We've done 150 cases, basically 150 second opinions, so to speak, where a treating clinician has had a situation like this abnormal lab test that they've seen, or they've found a child with a defect in their heart, but the person's almost 17, been fine so far, should I treat one way or the other? We can look through other similar cases and say, both ways kind of work out fine. You're good either way.
So Doc, what's maybe the thesis that you had going into this research study, and then what's the vision going forward after all the results are coming back?
So the thesis is to really use what we are doing for the people that we care for, to inform the treatment of the next one, learning from similar patients. And where we're going is, there's a lot of talk about the learning health system, and there's a lot of talk about electronic health records improving care. This is a concrete example of how, when data are electronic, it is possible to use them to provide guidance when otherwise you would have been guessing.
Okay, so exponential medicine, a lot of these ideas were back in, for instance, we have Dr. David Albert on, it was back in 1995, and it wasn't until new technology came along that he was able to make this, this device and utilize this data. What technologies need to change or adapt or come to fruition in order for this thesis to really have a great impact in the medical field?
That's a great question. So you might be surprised, the first time somebody imagined doing this was 1972.
Right.
And they actually built software to do this, but data were not electronic, and acquisition cost of the data was too much. Computers were not fast enough. And fast forward another 40 years, now we're able to go through data on 200 million individuals. We're able to go through clinical documents of 3-4 million human beings, millions of lab tests, 150, 200 million lab tests, and do that in a short amount of time so that by the time you get the answer, it's still relevant for the doctor.
Sure. So maybe what's the vision going forward then? If 250 million records are coming together, what type of impact would you like to see?
Ideally, I would want this thing to be continuously running in the background in everybody's EHR and only speak up, so to speak, when the computer has a suggestion for the doctor. So right now, it's still the physician has to go out of their way and request a consult, just like you do a second opinion, just like you order a biopsy or something. Imagine if this thing was always on in the background and it says, hey doc, I got a suggestion for you. But if and only if what it has to say is better than what you're doing.
Okay. So doc, we see you going out there, creating a thesis, solving a need, putting in the work hours to make sure that everything that you're putting forward is correct, right, and can maybe pass a lot of testing going forward. It takes a lot of leadership to do something like this, and obviously you're dedicating your career to this. So the last question I have for you, Doc, is what is your definition of a real leader?
I think a real leader is someone who imagines a change and then follows through to deliver on it.
I like that a lot. All right, everyone, we'll go out there, imagine a change, and for Dr. Nigam Shah, I'm Kevin Edwards, asking you all to keep it real. Thanks, Doc. Appreciate your time.